Welcome to The Health Perspective. I'm Dr. Daniel Gordon. In this episode, I'm joined by Danielle Lauren, the founder of Way Too Honest Mum Support Cards and a sincere advocate for maternal mental health. Danielle is a parent who went through severe maternal mental health challenges herself, including acute depression in the final weeks of pregnancy and into the postnatal period. Danielle shares her story of postnatal depression with a level of honesty that many people find hard to talk about publicly. We're going to discuss what the experience felt like, how she recognised that something wasn't right, what it was like trying to access support, and the steps she had to take to recover. Danielle openly talks about her experiences despite the difficult emotions that they bring up, in the hope that she can help other parents going through their journeys, especially those who may be struggling. Danielle, welcome.
Thank you. What a beautiful introduction.
How are you today?
I'm good. I'm excited to be here.
Good. Well, I'd like to thank you for being here and talking about this so openly, because I genuinely believe, and the purpose of this channel is because my belief is that open conversations like this really help break the stigma and help people find help when they need it most.
Yeah. And I have to admit, I also love the fact that you are a dad, because I think so many people who are very passionate about maternal mental health tend to be women, because it's such a lived experience. But it's so wonderful to have a dad advocating for maternal mental health, both as a parent and also as a medical professional.
Yeah. Well, on that note, as a medical professional, often when I see parents or children and I'm giving advice, I often caveat by saying most of my advice is coming as a parent, not as a doctor. It's not from my medical studies, it's from my experience as a parent, because the amount you learn going through all of that is, you can't put a number on it, can you?
No, I think we're all getting a billion PhDs on the job learning. Like, it's pretty insane as you're going through. Like the exponential learning curve is pretty intense, I think, when you become a parent. And there's definitely a before and after. Like, I think when you become a parent, your entire perspective of the world changes. You're not the same person anymore. So I don't know if you experienced that as a dad, but
Absolutely.
Yeah, you just you look at parents differently, you look at children differently, and it is life-changing in a way that cannot be completely explained, because it's all about a lived experience.
So on that, let's talk about expectations, because I think what we're talking about now is how we feel being parents. But what were your expectations before parenthood?
Of what it's like to be a parent?
Of what it was like, or what it was going to be like, pregnancy, labour, being a parent.
Yeah, you know what, I think what I found challenging about my own experience is I didn't grow up in a household where I got the impression that my parents liked being parents. Like, I think, but I definitely felt like I was an inconvenience. And so, and it didn't feel natural to me. And so where I kind of got a lot of my messaging about what it is to be a mother was from books and from movies, and the images of mothers in those spaces are of these goddesses, these beautiful women who love to self-sacrifice, who find absolute joy watching their kid outside playing football, and they're like, oh, I've fulfilled my accomplishment in life because my kid is giggling over there, and I don't need anything else, because if my child's happy, I'm happy. And so I think a lot of my images was a good mother is a self-sacrificing mother, someone who is willing to give up all of herself for her children, and wants to, because nothing could give her better joy than doing that. And so that's what my image of the perfect mother was, which was kind of a little bit of the opposite of what I grew up in. And so I think I had two very extreme versions of motherhood in my head, one that was not so great and one that was impossible. And so I think that's kind of been sitting in my subconscious for a very long time, which is very interesting then when you actually become a parent yourself.
And did you associate parenthood and motherhood with automatic happiness, or?
No, because I didn't. As I said, I got the impression from both my parents that being parents did not make them happy, and actually had a lot of fear and anxiety about that, because my mother gave up so much of her life to raise us. She was a very accomplished architect. She had a really big life, and so. And I always felt like she was missing out, and I don't think there was a shortage of kind of expressing that. So I didn't actually witness someone finding joy from parenting. I saw parenting almost like a service, as opposed to this thing that was going to, be delightful. But had hoped that that would be true. I guess I'd hoped, because I had that contradictory image of that self-sacrificing parent where it's like, oh my God, this is so amazing and so lovely, and I don't need anything more than this. And I think so. For me, I was filled with contradictory ideas of what it is to be a mother, and I didn't know if I was going to be happy, to be honest. When I approached my journey, both in pregnancy and post, in my head, I was like, I've never done this before. I don't know what this is going to be like for me. But it is a choice. I'm choosing to become a parent. And if I'm going to do that, I'm going to do it the best that I can and prepare to be the best mother I can in a way that I hope is going to be of service to my son.
So it sounds like you went in with actually quite a lot of anxiety in your own way, whether or not you consciously knew that you were anxious about it or not. Would that be a fair statement?
Yeah, absolutely. I mean, I think as a woman, even, I think there's this image of, from the moment you were born, one of your roles as a woman is to become a mother and to have children. And as you get older, there's so much more pressure around that. So I remember in like my 20s, started getting those messages, if you don't have a baby by 30, you're never going to have a baby. So as I was in my mid 30s, heading towards 40, that kind of pressure was very much there. My anxiety really existed because I'd built myself a career that I really, really loved and I was really, really passionate about. Mm-hmm. And I also got the impression from people who worked in the film and television industry, which is where I work, is that pretty much once you become a mother, it's really, really difficult to continue to have a successful career. And so I had anxiety about giving up myself and my life for this little being. And so I think, again, everybody's journey is different, but I didn't know I wanted to be a mother, but I also knew myself well enough that I also knew I didn't not want to be a mother. And I kind of oscillated between should I for most of my 30s, which made for very interesting conversations with my husband.
Okay.
And the only way I could make a decision, because I do think choosing to be a parent is a decision, was I just knew I had the confidence to go, if I don't want to be a mother, I would be totally okay with saying that. And the fact that it wasn't a no meant that it was a yes. But that's not a great way to step into your motherhood journey. But having spoken to people, that is also quite realistic for people. I know quite a few of my friends who are like, shouldn't I? And how do you make that life-changing decision? Because it is life-changing.
Yeah, and there is no way to practice. There is no, there are so many people with nieces, nephews who care for children and so on, but it's absolutely not the same as having your own children. There's no halfway house, really. So it's incredibly challenging to really, really know what it's like until you actually go through it.
Absolutely. Did you always want to be a dad?
It's a good question. I think yes, but I think without really knowing what it would be, and I'm delighted I've done it, but I certainly had completely underestimated the challenges that would come along with it.
What did you think being a dad would be versus the reality?
I think a lot of it's based on media and based on what you see. And I think when we see parents, even if we're not talking about, the kind of comparison and the perfect presentation on social media, generally when we see parents and children out and about, you are seeing the best of them, apart from the occasional tantruming toddler in a supermarket. But you don't see what has to go on behind the scenes, the incredible amount of work and support and mood difficulties and the sleep deprivation. You just don't see all of that. And it's really impossible to tell anyone about that in advance, because I think even if you're not being cliche, it ends up sounding cliche when you're trying to explain to someone about how sleep is going to kind of elude them for a year. It often ends up sounding like you're just dropping another cliche. And I think we have to be really careful about those, because, like you were saying a minute ago about your work in film and TV and having to give up your career, I think people unfortunately fill us with a lot of negative cliches beforehand, which in my experience as a parent and looking after a lot of parents with children, are not necessarily true. There are definite truths about the way that careers change, especially for women afterwards. But there are also there's a lot of confidence I think we can give people about the lives they can have after being parents as well. I don't know if you agree with that.
Yeah, I think going back to this concept of being a parent, a lived experience, like I feel I'm 2.5 years in the job of being a mom. I don't know what it's going to be like when at year 5 or year 10. And it's very hard to have perspective, if you don't actually know what comes ahead. And so I think for now, everything that I'm saying is through the frame of someone who's been doing it for 2.5 years, where I think if we had this conversation in 5 years, 10 years, 20 years, I would be able to kind of meet my perspective on motherhood in a very, very different way.
Yeah. And that's it's valuable that you're happy to change your opinion as you go. And it will change, because I think each age of childhood brings different challenges, and you change, you become a different parent at each stage.
Yeah.
I want to move the conversation to asking about your experiences a bit. And you've spoken to me before about the fact that the hardest time actually came before labour and delivery. So just tell me about when you first noticed something was not right.
So I was anxious going in before even falling pregnant. I had anxieties around what motherhood would be and how life altering and changing it would be. And so that anxiety I'd had this low level hum of anxiety. And then you go through the next stage, which is trying to get pregnant, which also is filled with a lot of anxiety and a lot of pressure. And for me, that feeling never went away. I would just kind of describe it as a low hanging hum that would just sat there in the background. And I think it was very hard for people to differentiate between that low hanging anxiety, because every parent or every woman who's about to, who's pregnant and is about to have a baby will feel some form of anxiety, because it's life changing. But for me, it started to build more and more as I got closer to my due date. And as someone who likes to be prepared, I read everything. I probably watched way too many videos on social media. When I went to have my first meetup with the obstetrician, he's like, where are you even getting these questions from? Because my way of coping with my anxiety was to be informed and to be researched and to be prepared. So I also put mental health support in place because I had anxiety. And so I'd tried to give myself a really good foundation going in. But what happened to me personally, because I was a planner, I was like, if I can have control over this thing that I just didn't feel like I had much control over, it would help. And so I'd organized to go and visit the hospital where I was going to give birth, and actually go to the birthing space, because when I had met my doctor, we'd always met in the rooms, and I was like, I don't want the first time I'm in that space to be on the day. And if I went there beforehand, I would feel maybe safer and more prepared. But actually it ended up having a completely opposite effect on me. Instead of me feeling like, okay, I've got this, my brain went, no, you don't want to do this. You can't do this. This was about 2 weeks before my son was born. And it's weird because it wasn't a form of psychosis, but for me, the hospital represented death. I was like, this is where I go to die. And not that I thought I was going to be bleeding on the table. It's more like my existence, my ego, my entire being dies in this place. And I felt like, I just remember just having this, everything just felt very like, I had this image of you committed the crime, you chose to become pregnant, and now you're going to die. You're going to go to the death, this is your death penalty, and you knew this was going to happen. This is what's going to happen to you. And being in the hospital and hearing babies crying, it literally in my mind, I felt like I was on death row, and seeing the Guernseys go past and the bars on the window. And I was like, I'm going to die in 2 weeks' time, and it's going to be a really, really slow death. And it was such a painful place that I was like, why would I die slow if I had the option to die quickly? And in my head, pretty much, I left the hospital. I was in the car with my husband, and I was like, I don't want to do this anymore. I don't want to do this. I don't want to give birth. I don't want to be here. I don't want to. And because I was blaming myself so much. I was like, you knew this was going to happen. This is what was going to happen to you. And I was just like, I want out. And so my husband, being lovely, did not realize at the time, I think, how extreme my thoughts were, because I really went from 0 to 100 in terms of my own, starting to plot my own suicide. And he went to go get me ice cream, because ice cream always makes me feel better. And so he left me in the car, and my mind I just started thinking about how I was going to do this. And I think what's really interesting, and everybody's experience is different, is I think when you're plotting your own demise, it's a very personal experience. And so you want to be able to have control over it, because it's kind of the last form of control that you have. And so whilst my husband was going away, my mind was just ruminating about how I'm going to do this, how I'm going to do this, how I'm going to do this. And then my husband gets back into the car and he hands me the ice cream, and I'm static. I'm not moving. I'm just like staring down, but my head is going 1 billion miles an hour. And then somewhere a tiny, tiny voice in me just started to say, tell him. And I really didn't want to listen to that voice. I did not, because I didn't want to give up this little control that I had. I didn't want to give up the answer I had. But I just kept going, tell him, until it started screaming at me, tell him. Now my husband's just sitting next to me, and all he sees is this, but my voice is whatever. And then I confess what I'm experiencing, and I really, really don't want to. I don't want to tell him what's going on. And I tell him, and I don't think he at that time really understood how serious this was.
Because this has come completely out of the blue to him. Have
Yeah.
you spoken about... So, I mean... would it be fair to say that you spoke about this background hum of anxiety, but would it be fair to say that it probably had been gradually increasing through the pregnancy?
Yeah.
And then this visit to the hospital was just this kind of trigger for it all to kind of release.
Yeah.
But had you been speaking about your anxiety to your husband?
Yeah, I had been. And so he knew that there was anxiety. And so he may have just thought it was aligned with kind of just the general feeling of, okay, I don't want to do this. But I don't think he realized at that point, I'm not going. I think I moved from, I don't want to do this, to I'm not going to do this.
Right.
And that was so clear in my head. And I felt such relief that I found a way that I was not going to do it. And so I think being the witness to someone in that situation, and actually trying to decide, try to work out what to do must be really confronting. And I think, I don't know what maybe gave him the idea, but he decided to call my psychologist at that time, who wasn't in the country. And I had a conversation with him, and he said, he's like, take her to the doctor straight away. And that's what happened. And that's how I kind of started my journey for getting help. But yeah, it was, I don't think we're luckily at a time now where people talk about postnatal depression, but I don't think we talk enough about what it's like to be pregnant and being suicidal. And what was interesting to me, having gone through the services, is it makes sense. If you're scared about your birth, as you get closer and closer and closer to that date, that anxiety is only going to get more real and more strong. And actually, that's where you need to have more scaffolding. You need to have more support. And also, you need to know that this can happen. And that's what was really eye-opening to me, is I tried to put in place support post-birth, but actually no one really talked to me about pre-birth. And even when I had done those kind of tests, like how are you feeling, etc., no one really picked up how serious what was going on behind the scenes for me was.
Because my instinct as a GP, listening to your story, is to think that even 3 days before this hospital visit, probably you were actually in a really terrible place. It's just that you were masking it so well and keeping it so well kind of under control. It's just that the hospital visit allowed what was there to come out, rather than there being this kind of sudden deterioration. I mean, do you agree with that?
Yeah, I think so. Because you feel like you're a pressure cooker.
Yeah.
Because the feelings are there. So you have that, then you also have everyone around you adding to that anxiety and that fear. But I do, it felt like a PTSD reaction. It just felt like it could have potentially just been a release, that it's like I can't contain this anymore because there's nowhere to contain this. And
the analogy I give to my patients with anxiety in general is like a Coke bottle, like a bottle of soda which is shaken up. And if you're shaking and shaking and shaking, if you've got little holes in the bottle which you've learned to put in, through psychological therapy, through medication, through exercise, through whatever it is, then the pressure continually escapes. But if you don't, then what happens is when you take the cap off, you get this massive explosion, which just sounds like your visit to the hospital was almost like the perfect storm.
Yeah.
I want to touch on something else you said about postnatal depression and prenatal. And I think that the only problem with the term postnatal depression is I think it really sets up the societal view that it happens always after we have after labour and delivery. And actually, the truth is the majority of cases happen in the 4 to 8 weeks after. But actually, if we use the term perinatal depression, which is anything from pregnancy until afterwards, yes, the majority of cases happen immediately after, but actually plenty happen before, during the pregnancy period, around the time of labour and delivery. And I think the awareness of that is quite poor because we tend to think of it as postnatal depression so I think a lot of expectant parents are thinking about, okay, I need to make sure I look after my mental health and look out for myself, and I need to look after my partner in these 2 or 3 or 4 or 6 weeks after. But I think that then people are missed in the prenatal period.
Yeah, there's no discussion. And as I said, I did so much research beforehand to try prepare myself, and I just didn't pick up that pre-preparation. But and I think this is also why I feel so passionately about speaking about it, because it just takes, one woman who's pregnant who may be going, oh, I kind of feel that a little bit, who might actually realize that it's not just happening to her. And I love that idea of it just being perinatal mental health. And for us having these conversations, from the moment you're pregnant, like you are physically, mentally, spiritually completely changing. And how do we support people through that? And if you are having anxiety and you are starting to experience things, that it's totally okay for you to tell people, but also for people to be able to react with the seriousness that they might postnatally.
So one thing that strikes me about your story is that you are now have become very severely unwell from a mental health perspective, but you're only 2 weeks away from labour and delivery, which is probably one of the most psychologically and physically stressful events in a woman's life. So what happened in that 2 weeks? What happened next?
So I went to see a GP, and she put me in touch with perinatal mental health services. In case you can't tell by my accent, I'm Australian, and I had chosen to give birth in Australia, so I was being taken care of within the perinatal mental health services in Australia. And fortunately, I was seen straight away, and in their mental health services, I had like a preliminary meeting, and then I saw their psychiatrist, who put me on antidepressants. Again, a huge thing 2 weeks before. 2 weeks before giving birth. Now I'm on medication, and the perinatal mental health team would come to visit me every single day and check on me every single day. And basically they guided me and helped support me and also my husband to be able to be there. So they helped me kind of process a lot of the feelings. But I think one of the best things that team did, well, 2 things. One, they normalized what I was experiencing, because you spoke before about the Coke bottle. If you think that it's totally wrong to be the Coke bottle, you put additional pressure on yourself. And they made, firstly, they helped remove the pressure, and they normalized my feelings so that I didn't feel ashamed about what I was experiencing, and they gave me context for it. But what they also did is we completely changed my birth plan. And so I was going to give birth in a private hospital. They moved me to a public hospital. One of the reasons is because there was zero psychological support in a private space, where if I was on in the public hospital, they had therapists on ward. We also changed my actual birth date, because I was meant to give birth on a Friday. I chose to have a C-section because of my anxiety. But mental health service, the psychology team only worked Monday to Friday, 9 till 5. And so if I was giving birth on a Friday,
wouldn't be best timing.
Would not be great. So my medical team moved my birth date 1 day earlier, so that I would at least have more time with the psychologists on the ward in case I needed that additional support. And then every single person who came in contact with me at the hospital, every single person, no matter who they were, had to read a report about my mental health. And they were also taught how to speak to me and how to act. So no one was going to come into post-birth or pre-birth going, oh my God, can you believe it's today? How are you feeling? Wow, this is so... No one did that. Everyone like met me with calmness, understood that I was anxious, made sure that I was okay, kept checking in on me. And so they met me where I was. And so my actual birth experience was phenomenal. Like, I feel very privileged that actually when I think about the birth, I loved it. It was great. I felt taken care of. I felt seen. I felt prepared and I felt ready. And it's because I knew I didn't have to pretend anymore. I didn't have to pretend. So from being able to have conversations with my anaesthetist about my anxiety, everyone knew and everyone treated me with, I think, the delicateness that I needed in that space to make me feel safe. And so I feel very privileged. The actual birth was phenomenal. But then post-birth, that's when it kind of kicked off again in terms of the feelings of depression and anxiety and plus post-birth you're dealing with all your hormones and the baby's there and all the sleep deprivation. But at least at that time I was in the hospital under the services and every single person knew how to meet me in that space. And I think it made the world of difference.
So tell me about post-birth then. Tell me about, so what it sounds like so far is that this, crisis, I think we should use the term crisis here, was quite a significant anxiety release for you. And it sounds like you actually got better is a terrible phrase, but you had at least some recovery from having the support and the release of actually being able to discuss openly your anxiety. And but then I guess there's that period, but then there's the reality of actually what has to come next and the labour and the delivery, but then afterwards the childcare. So when did things start to deteriorate again?
So I guess two things I want to say on that. One, I think being suicidal 2 weeks before I was pregnant was probably the worst thing to ever happen to me, because it removed as that pressure. And I think that was a huge, that release did make such a world of difference. But those anxieties were real, and that pain was real, and that fear was there. And there's a term, I'm just trying to think what it is. What is it? So when you think about someone who's like a functioning alcoholic, I always thought I'm a functioning depressant, that you can meet me and I can appear as strong, okay, together, intelligent, have my act together, but there's lots of things happening underneath. And I remember saying that to the psychology team. I was like, at this moment, you're going to meet me and I'm going to seem like I'm totally okay, but you can come back in 10 minutes and I might not be okay at all. I'm very good at doing emotional containment around it. And it was true. So, at times when I felt more safe, trying to recover, I was going for little walks around the hospital and I was with my husband and I was just bawling and I was in tears and I was scared and all those feelings were kind of there. And then it was really a roller coaster of ups and downs. Like I had, I felt like maybe 80 to 90% of my days were really struggles. And then maybe I'd have these like little glimmers of just joy. So it wasn't like this complete cloud, but that again, when I talk about that overall hum, so now it'd been amplified. Now it was like 80% just feeling, I don't know how I would even describe it. I felt a little bit like the living dead. I just didn't. It's so weird because I think, I don't know what it's like for everyone else, but I think when you're in such a traumatic time, it's almost hard to remember what it was like in those space. Plus, I think in the early motherhood and early fatherhood, you don't really remember. But
I find it interesting that you actually find it quite easy to recall and remember the crisis.
Yeah.
But then the blur of the postnatal, you're struggling much more at this point, and I think that does say something about that blur and probably how much you were still struggling. Because I think one thing when we're depressed is our memory is affected, our concentration is affected, our focus is affected. So I do find it interesting, I guess, as a doctor, that this is the bit that you're struggling to recall with as much clarity, if that's fair.
Yeah, in my crisis, I've never been so alive.
Yeah.
Because I could tell you the color of the fence and the next to me and the chips and the deterioration of the coloring of the grass and the sounds. Like for me, it's so vivid. I can go there immediately and I could paint it for you. Where then the depression at all days blur into one. It almost feels like I didn't experience it, because you're right. I can't go back there. I can't remember it. And I think it's so interesting. And no one's ever said that to me. That's really fascinating that, in the critical time, I can be very present with it. But in that post, all I remember was it sucked. It was awful. I hated it. And I think coupled on that was, extreme guilt, because now I had a little human that I knew deserved love, kindness, presence, and I was struggling to be there for myself and doing the absolute best I could for him. And, I think you have such very little energy as a mother, and all that energy I was trying to give to him. And so I was quite depleted in that space, but just doing my best to kind of do it all. But it was not an easy time. And I just remember hating it. And I just remember thinking at that time, if I can get through this, I just don't want any other woman to feel how I'm feeling. And I think that's why I become such a huge advocate for this, is because for me, even the idea that period of time could end seemed like a faraway concept. But I was like, if I can get through this, I just want this to have meaning, because I don't want anyone to feel how I felt.
When did that period of time end for you? And I'm going to be very careful not to say when did you get better or when were you fully fixed, because that's just completely not right. And I think that sounds like this experience and the crisis and everything has probably changed you forever to a degree. But how long did that period last? And I guess how long after your labour and delivery do you feel that you could say you probably weren't depressed or you were in a better state of mental health?
Probably around the 20-month mark. Yeah. I started to feel a bit more functioning around 8 months, but to really feel like more days are lighter than dark, it took me 20 months, just short of 2 years. And it's a really long time to be in that space.
Yeah. And again, you talked about happiness and everything and hating it. And these are emotions that many parents will go through. And that expectation that it's all going to be fine and every day is going to be wonderful, it just really needs to be challenged. What was the role of your partner in all of this? Like where was he? And it sounds like it must have been really difficult for him as well.
Yeah.
To know how best to support you.
Yeah. Sorry, I'm getting a bit teary.
It's okay.
I did warn you, and
it's okay, I'm sorry.
It's okay. No, because I think when we talked about 20 months and it being a long time, I do feel that parts of my life were stolen because of depression. Not only my life, but also the time with my son, was taken away because it took me such a long time to recover. So, I think that to me gets to me, because, no one wants to feel like their time on earth is stolen, and that's what I feel like depression did for me. And so, that's interestingly enough, that's the thing that kind of, I think, causes me a lot of pain now.
Can I touch on that a little bit more? Because you talked about your relationship with your son. So how was your relationship in those 20 months? And I guess what's so triggering right now for you when thinking back to that time? Because again, there is this expectation that you will bond and you will feel love and that this little person will become your all, but not everyone feels like that, do they?
Yeah. Look, I was so lucky because I did have that connection. And again, because the perinatal mental health team were worried about the fact that I might not, because I was feeling depressed. One of the women said to me, she said, imagine you're on the street and a random person comes up to you, gives you a giant hug and says, can you feed me, please? And can I come to your home? And you'd be like, excuse me, stranger, I don't know you. Why are you hug? But this expectation, suddenly you have a new housemate in your house. And I think they just tried to prepare me for the fact that if I didn't have a connection, that was okay. And that for some people, I've got friends, both mothers and fathers, who took a while to kind of build that love and build that relationship. For me, it was lucky. It was instant. I felt a connection with him when I was pregnant, and I felt a connection with him from the moment I was born. I'm like the Taylor Swift song. It's me. I'm the problem. It's me. It was never him. Like I would do anything for my son, and I love him. And, I'm going to have to deal with the shame for the rest of my life that I could have taken his life with me. And that's something that, I have to come to terms with. But I mean, he never did anything wrong. It was me. I was unwell. And
but just to challenge you, I don't think you did anything wrong. I think you're unwell.
Yeah.
And that's really what we're trying to do in the video, is make sure that we break the stigma that it's anyone's fault.
Yeah, absolutely. And so it's, I was unwell. But no, I feel he is my entire universe, and I love him so much. And I feel so grateful that I love him, because I cannot imagine what it must be like to be going through your anxiety or your depression or your psychosis or OCD or whatever your mental health issue is, and not have a connection with your child at the same time. I think must just be really, really tough. And what do you advise your patients in that situation to do? Like, how do you help them manage not only their mental health experience, but also not having a connection with this little being who you're meant to have this instant love for and self-sacrifice for?
I think in the main, it's for me, it's about bringing realism to my patients. I see it. I meet a lot of new parents, and a lot of new parents who are struggling to develop the emotional connection and bond to their child that they believe they should have so early on, based on societal expectations. And normally, as a GP and a compassionate GP, it's just about reassuring people and about making sure they understand that things take time, and that those first few weeks, the newborn period, and really the first 4 to 6 months are the absolute most challenging period, because you don't know what you're doing. The baby isn't able to respond to you with smiles or kind of reaching out for something you're handing them, or there's no reciprocity really in the relationship. It's extremely challenging. So in the main, I mean, I think firstly, my role is definitely to recognise if there is something serious going on, like postnatal depression. But in the main, it's about reassurance that this is okay. Don't stress about it. Just take each day as it comes. I think that's one of the most important things I can do, just bringing that dose of realism in.
That's lovely.
I asked you about your partner. I don't think we kind of got into it, though. Just kind of where was he in this? How did he manage in terms of helping you and knowing how best to help you?
Oh my goodness. Firstly, I married the best man in the world, and I feel so grateful that I did. But I don't envy his position at all, because I think he felt extremely helpless. He wanted to help me, he didn't know how to help me. I think he was very worried about doing anything wrong. He didn't want to make it worse, but he didn't have the skills to do it. My husband has phenomenal IQ. And he'll admit this too, his EQ is not the strongest either. So now he's having to deal with something that's extreme emotions. And I think he also put a lot of pressure on himself to not add additional pressure. So he really stepped up and trying to be there and trying to be practical, do practical things and try to alleviate pressure, facilitate the space for me to go get that help. But I think it was very painful for him. And again, I think the expectation that a partner should somehow know how to meet you with years of therapy experience, I don't think is fair or reasonable. But they are the person who's there 24/7. Yeah. And so it's I wish there was more support for partners of people going through something, just to make sure they're also being supported, because he's also become a dad and going through his own life-changing experience. And so he's having to hold a lot.
Sounds like he was kind of caring for two people.
Yeah.
Really at the time. Yeah.
I mean, I'd like to think most partners are caring for two people, especially if the birthing person, they do need to have that extra care. But in terms of someone, I wasn't capable of looking after him, because I was barely being able to look after myself. He did his best. He always does his best. But I think it's really, really hard. I think the best thing that he did was take me to the GP and call my therapist and say, this is what's going on. But I think, I don't think it's fair. I think we want our partners to be that person. We want our partners to somehow be our therapists and our supporters and our guiders, etc. But I don't think that's reasonable. And I remember having a really good session with because the perinatal mental health team would also meet with both of us, and they'd ask the right questions. And I remember saying to my husband afterwards, I was like, but why don't you ask that question? He said, because I'm not a trained professional. This is what they do for a job.
Well, it sounds like he did a great job of spotting when something was seriously wrong and getting help, and calling for professional help. And that is definitely something I see in new parents, which is challenging. And it's not that anyone is trying to play therapist or anything like that, or trying to avoid seeking help. But I think the problem is often these things don't happen overnight and they change over time. And partners are trying to be as supportive as they can, and they're listening and they're asking the right questions. But I think that sometimes, your partner is not your therapist, and they're usually not a trained mental health professional. And therefore, it's really important that you need to outsource that. If someone is struggling, I think your job as a partner is also to help them understand we need to get professional help for you.
Yeah. How do you, when you see couples and, in your practice, how do you differentiate, how do you help them understand the difference between, okay, there's someone's having a bit of a bad day versus, no, actually there's something a little bit more heavy happening here.
I'm really direct.
Are you?
Yeah, I'll say you're not a therapist, or you're not. This is too much. We need to get you some professional help.
Yeah.
I often find that the labels are helpful, and I think that helping people understand the gap between normal and abnormal, and for me, I'll explain that having feelings of worthlessness, hopelessness, not enjoying life, feelings that you'd be better off dead, for example. Everyone can experience those from time to time, and they are part of a range of normal human emotion. But if they go on for a certain amount of time, and if they are severe, then they are not normal, and actually they can respond really well to treatment. And I normally say to people, you don't deserve to feel like this. As in, this is not how it's supposed to be. You can feel better. You're suffering. And if you had come into my room with pain in your abdomen and a fever, I'd be sending you to a surgeon and you'd be agreeing. So why would we do anything different other than get you the best possible help for this problem? Just because it's a slightly different problem that you can't see or feel in the same way, it doesn't mean that we shouldn't take it as seriously.
Because there's so much stigma around mental health when you're dealing with your patients, I know you kind of alluded to it now, but how do you, because I think so many people suffer in silence. For people who are listening to this, I guess, from your point of view, why and how do you get people to kind of speak up about what's happening for them internally in terms of their mental health?
That's a really difficult question. And I think, honestly, it's about finding trusted people who and who are trained. I think fundamentally as a GP, a lot of people think that I see coughs and colds all day. And I do sometimes see coughs and colds all day in the middle of winter, but my main training is in communication and just the ability to see through what people are saying and try and lift the mask. And I would hope that if someone came to me struggling as much as you were in the period of time before delivery, I think you're someone who's very good at masking, not to kind of psychoanalyze you, but you clearly, and a lot of people can hold this face to the external world, of control and poise and well-being, but internally they may be absolutely kind of falling apart. But I think my job as a GP is really to kind of pick up on those cues, those non-verbal cues. This is where I think we'll never be replaced by artificial intelligence, because just sitting with someone and seeing how they move their body, how they move their posture, the way they relate to certain parts of their story compared to others, allows me to try and help them unlock how they may actually be feeling, even if they don't know it themselves. And not everyone is sitting in front of me in a room knowing that they want to really talk about something but are too embarrassed. A lot of people don't know, but it's my help to kind of, it's my role, and psychologists and other doctors too, to try and gently and safely kind of bring them to that point where they're able to talk about it.
Yeah. Well, thank you for doing that.
That's okay. I hope I do it.
I hope you do too.
So when we've spoken previously, one thing you're very passionate about is the idea of traffic lights, or kind of orange flags for maternal mental health. Tell me a bit more about that.
Sure. So when I was in my my moments of crisis, someone said to me, "What are your oranges?" And I'm like, I don't know what you're talking about. She said, you know when you're feeling good, and that's your greens. And she's like, you know when you're really not okay, that's your reds. But she's like, what are your oranges? What are the signs, the little kind of clues that are heading, that things are not quite things are not quite going in the direction that you would like them to be. So do you notice, for me, that would be, I'm eating less healthy, I'm not going outside, I'm probably becoming less social, everything starts to feel harder. Like, what are the things which are like signals? And I think everybody's is different. But I think being able to work out what are the kind of clues, almost like the stepping stones to red, is just really, really helpful, because it can help you, it can stop you from getting to that. So it's like, okay, well, I'm clearly not okay. And I think something that you've also touched on is being able to differentiate between, is this a bad day or is this something more serious? Because everyone has bad days. But if it's starting to be, okay, well, I love to go to Pilates 3 times a week. If I'm noticing I'm not going at all, or I like to go to my favorite coffee shop, but I'm not going. Okay, is this a 1 day or 2 day thing, or is this happening over a couple of weeks? Well, then those for me are real signals that I may be heading towards down. And so I really, again, everyone has their own version of what orange is, but I think taking time to go, what are the signals that I can see beforehand, that can maybe give me clues, because it's you don't want to get help at red. You want to get help at orange, because it stops you from going to red. So it's at those times where it's about speaking to your support system, whatever that is, and going, I've just noticed this is what's happening for me right now. Can you just keep an eye on me or help me? And so for me, it's just about, I want to, probably like you, avoid people getting to that place of it being critical, because that's the worst case scenario. And actually, can we stop people in that intermediary time and try to get them back into the green zone?
And one thing I'll recommend quite a lot for people, I think for people who tend to be a little bit more well versed in their mental health, I think someone at your stage now is mood tracking apps and things like activity tracking apps, because if you do understand those orange flags, it still can be quite objectively hard sometimes to notice, because how many times do you sit back at the end of the day and say, did I go to my coffee shop today? Did I do my Pilates today? Whereas actually, if you bring some kind of objective system in, whether it's journaling, whether it's a mood tracking app, actually, I find that really can be extremely helpful, because you can get a little red face, or a happy face, and it just can make you stop and think back and say, well, actually, the reason I'm feeling so fatigued and not myself and a bit grey is, if I look back at the week, look how much I've missed that is normally protective for me.
Absolutely. And also you can maybe spot triggers, which I think, because I had the same thing, a therapist was asking me about how I was doing, and I had no context. She said, just track for a couple of months. And it was very interesting when I could actually see, for me, a lot of it was actually connected to my cycle, and I had no idea how much that was affecting my mental health. But it was only by actually having that data that I was able to go, oh, well, that's interesting. And it changes now every month. I'm like, oh, I know that last week's not going to be a good one for me. And therefore, I put in place things to support myself. Or if I'm feeling down, I have some kind of connection to why that might be. So yeah, tracking is a very good way for you to have perspective, especially at a time where you can lack it.
So how are you now? And if you were someone listening to this, what would you want them to know if they're in the middle of it?
Firstly, I would say I'm sorry. Like, I know how hard it is to be in that dark hole. And it's very hard to see out of that hole. And it's hard to imagine that that's not going to be your forever state, but it really, really isn't. There's no shame in getting help. In fact, it is so powerful for you. It is the greatest act of self-love to be able to hand over yourself to someone else to get to get support. And I guess I would just say, keep showing up. This is not your forever world. There are people and services who can give you an alternative to the experience that you're having now. And it does exist, and it does get better. And even though it's impossible to imagine it, this is not your forever state. And actually, you will be bigger, greater, wiser, stronger more compassionate, more purposeful post it, and you will relate not only to yourself differently, but to the world because of what you've experienced, and you have the opportunity to turn that pain into purpose, but just to keep going. And if you are in a time where you are feeling critical, please call a crisis center, please tell a GP, please speak up, and you know, unfortunately, not every time someone speaks up, they do get heard, but that's not got anything to do with you. Keep speaking.
I completely agree.
Because I think, you know, sometimes it's just luck of the draw who ends up being on the other side of that call. And sometimes it's the wrong person, and that's got nothing to do with you. Just keep fighting for yourself, because there's a world that is lighter, brighter, and it will change. You'll be so grateful when you get there, and you'll be able to give yourself a bit of a pat on the back because you made that happen for yourself.
Yeah, I don't think I can add to that. And I think you know, that's what I say to my patients when they are in the throes of depression. You know, you will not always feel like this. And I think that's one of the biggest problems, is the fear of always feeling like this makes life feel worthless and hopeless. I mean, who wouldn't feel hopeless if you felt that for the rest of your life you were going to feel so terrible? So the most important thing for me, one of the most important things to communicate to people is and I try and communicate it with confidence as a doctor as well. You know, I've looked after lots of people, and I'm really confident you're not going to feel like this. But there's a lot of stuff we're going to have to do to get you back to where you want to be.
Yeah, and I think having been in the perinatal mental health services, and that I've had an opportunity to meet other women who've also been in those services, and all our lives are different now. When we were in the throes of it, it was pretty horrendous, and I wouldn't wish it upon my worst enemy. But just, yeah, keep doing the work, even if you don't want to. Keep speaking up, even if you don't want to, because it does. It's there's a beautiful gift on the other side of it.
Danielle, I'm so grateful to you for not just joining me here today and giving your time, but actually for speaking in a way so candidly. And I know it's hard for you, and it's really triggering, for speaking so openly. And I'm absolutely certain that this is going to help someone watching it at some point in the future. So I'm really grateful to you. I think we should also say that if anyone watching has found any of this triggering, or is struggling, that we're going to probably put some resources at the bottom to make sure that they know, in the links of the video, to make sure that they know how to access help.
Yeah, thank you. And I mean, that's why this is the biggest gift. I just want to make sure that other women feel that they're being seen, heard, and supported. And thank you for providing a space for us to talk about it today.
Fantastic. Thank you so much.